let's first think about 2030 and the coming decade, what it signifies for us. Today, we are infested with multiple sources of information, whether we talk about data and analytics, technology, healthcare at the core of everything, multiple things that influence our lives. The next decade, in my opinion, will witness new models due to influence of demographic changes, which will dramatically impact services which are needed and how they are delivered. The impending movement of the baby boom generation into retirement will continue. In addition to this, the millennials and younger cohorts will aspire for greater influence over delivery because they are now in charge of their own choices, their own methods in which they want to consume certain services. Concurrently, market factors like the payers, governments, insurers, they'll also have a significant impact on healthcare, wherein they'll push for lower cost of care and greater packaging of services. As the cost of care escalates, I think these pressures will also dictate the way in which services are delivered. So, basis this, I'm also thinking from the consumer side. If I'm a customer, going forward, going to try to seek treatment for sickness and aspire for investment in my own wellness. And I'm a millennial, thereby trying options for care outside the hospital instead of going into the hospital because hospital care is going to cost a lot. Therefore, I also see the term hospital getting much more used as technology disrupts monitoring of patients. On the supply chain front, already we have seen many new inventions, many new models coming up where healthcare is focusing on efficiency and cost cuts with newer models which aggregate the demand and offer generic options also through multiple e-health and m-health channels. And I believe that is just going to go up, and there's no stopping that sort of innovation. Now, if I were to look at the top 4 or 5 trends, these would be my observations. First, how do we address the demographic divide? And is there a solution for the providers, given the fact that you're going to be ridden with older customers who need chronic care help and the newer customers who are used to this e-tail kind of environment? So we need to start serving customers in different ways using models which will appeal to them and which will help them ease in terms of consumption. I cannot tell a 70-year-old today how a mobile app is going to work, how they need to scroll through multiple options on a 4-inch mobile screen or a 6-inch mobile screen and ask them to choose from there. That might be inappropriate. On the other hand, I cannot tell a 20-year-old that I'm not offering something on the mobile app because he's used to consuming all the content on the mobile app. So that's the form of expression, that's the form of consumption that's going to get used, and we need to start thinking and weaving our models basis these different kind of age groups we cater to. The care seems to be moving more towards the patient, which requires a larger play in terms of digital solutions, which will combine the retail shopping experience, care pathways for standardization and patient safety, teleconsultations so that people do not have to wait in queues. I think that's becoming one more important factor where people hate waiting for their turn. And how do we integrate with IoT devices? What kind of technologies are we going to use? How much data from a smart band, from a glucometer is going to be incorporated so that the doctor can make better decisions, the patient care can be better. The second part, price factors addressing cost of care. As more people start buying insurance, they start getting into the other side of 50s, you'll see that there is going to be a larger consumption of healthcare services. And chronic care is one of the toughest parts to address if it starts moving into acuity. So that's why hospitals will have to look at different models in which they're looking at delivering acute care, improving the throughput, and anything that is subacute or chronic starts moving outside of the hospital. Thereby, the fixed cost that is incurred in a largely loaded asset like a hospital starts getting lower per admission. In addition, When healthcare providers start moving their care outside the hospital, they're mobilizing care and they're addressing a larger chunk. And that's how you will address the cost of care concern as well as the price of the services, which is perceptible for the patient. There needs to be a very harmonious mechanism where multiple providers who specialize in home care, who specialize in subacute care, will come together and give patient options to make sure that the patient is engaged throughout. If I want to get treated at a daycare center, if somebody wants a delivery only in a specialized mother and child care center, that needs to be enabled. Same thing with a physiotherapy. I don't need to go to a center for a physiotherapy. A home physiotherapist needs to come in. That's how you will be able to engage patients if you have that ecosystem, and the same patient will opt and choose whatever form of care and care delivery that is suitable for him at a particular time. It could be virtual, it could be physical, and both these need to be feasible. Third part, which is probably the most important and least emphasized in today's times, is how do you elevate the patient experience? And it's not just about expensive buildings. It's not about talking fancy things when you talk of patient experience. It is about thinking about the customer at all times, the way an Amazon does, the way most companies who focus heavily on customer do. Healthcare will need a similar approach to keep pace with the rising expectations and the choices that a consumer will have at his fingertips. Because initiatives like ABDM, Ayushman Bharat Digital Mission, are going to bring all of these things together. All the practitioners, all the centers will be available at the click of a mobile button. That's why the patient experience is going to differentiate what healthcare providers are capable of doing, forging connectivity and reciprocity between health systems, building a tiered structure wherein institutional care providers, telehealth providers, home care providers, e-pharmacies, home diagnostics, and IoT services coexist to efficiently deliver care basis the patient requirements will be the future of healthcare. The first movers in this space who can manage to create this entire ecosystem and who will be able to deliver a layered experience through specialists in each of these services with high efficiency will hold a significant advantage, because the payers, patients, as well as governments will appreciate it to know, because of their ability to transcend the barriers of region, clinician preferences, and thereby this first mover will reap rewards from all the payers as well as patients to a very large extent. Now, the last part that I want to address is how do hospitals or care providers who have been traditionally very popular and who have spent decades and decades harnessing their institutions and preparing themselves for all kinds of patient needs start fighting off the new guard, which is the technology solutions, the startups who want to influence patients, who want to deliver care in a different manner. As demand for healthcare and convenience grows together, there will be a radical change in delivery models. Traditional players, who I said have invested decades and decades in terms of healthcare, they will still want to retain their business. They want to advance their business. They want to retain their customers also. And they will believe that because they've invested so much time and resources, they are the best at doing a certain part of care. However, there is also a threat that they might lose to the new age customer who wants a different delivery model. And that's where they need to strike a balance. They cannot imagine that any tech tool, any digital health movement can be done by a healthcare provider himself or herself. It's not that it's not possible, it's just not feasible. You need to create a partner ecosystem and not get into doing all things by yourself. A hospital that has traditionally run for 3 or 4 decades needs to understand that I'm good at clinical care. I'm good with my doctors, my nurses, my care pathways are very robust. So that part can be managed by me. But when it comes to a digital health tool, when it comes to a patient app, when it comes to weaving things together and giving different options to patients for care provision, at that point in time, I need to take help of a partner ecosystem who understands and who works day in and day out only in terms of customer services and managing all of these options. One of the major options can be me, and that is the care provider sitting within the hospital or providing institutional care. And that's the only way you can forge this relationship. Intertwining the physical and technological experience without going for indigenous ways to develop technology will be key to this rapid movement towards a phygital hospital or phygital care that we are going to provide over the next decade. And definitely 2030, we should be at a very mature stage of the same. Providers need to be in the business of care delivery, and they need to adopt a very collaborative mechanism with tech players to make sure that they are ahead of the curve, or at least keeping pace in terms of digital health and the customer needs. Given the above scenario, what will it take to make the difference in this next decade or in terms of Vision 2030? First, put the customer at the center. While it's an overused phrase, all stakeholders must analyze demographics, clinical needs, disease patterns, and technology movements. What's working in a particular geography? Is it just, I mean, in layman terms, is WhatsApp a preferred method of consumption? Is ATL still working? What is it that influences patients first? That's the first point. Second thing is, because there is such a good penetration of cell phones, mobile first needs to be the option for discovery and triage. If you can discover, if you can manage that the clinician can be discovered, the hospital can be discovered, care provider can be discovered, and the triage can be done on the mobile itself, then you've won half the battle. Post that, it's about your standardized clinical pathways and the quality of clinicians within your institution who can provide care in the right manner. The second bit that you need to do is commit to outcomes. Payers, providers, everyone needs to start moving towards value based care. If you can commit to a good outcome, let's say a patient has gone in for a cardiac procedure, and your outcome is for the next 5 or 10 years, I'm going to track whether this patient is having a very healthy lifestyle, is having no issues in terms of heart, and can manage their life in a very good way. Then you're committing to an outcome. But if your attitude is that I need to get the surgery done, then that's not an outcome based approach. So once you commit to an outcome, the payers and providers both need to make sure that the mechanisms incentivize this. The healthier people are, the more healthcare will be incentivized for care providers, and payers will also bleed less. The third bit will be about tech tools, IoT devices for chronic care, real time alerts, decision making tools wherein you're triaging patients, you're giving them the right advice in a remote place where they're not able to find a hospital. There's still so many places like that. Predictive analytics to forecast any potential risk of readmission, any potential risk of a pandemic, epidemic that's going to spread. That is what is going to be at the forefront of technology. Behavioral analysis, which is quite underrated right now in hospitals and healthcare, will also come to the fore, where you need to understand what exactly is this patient going to do. If it's a 60-year-old patient, how is he going to behave versus a 20-year-old versus a 40-year-old? What are their purchase patterns? What are their behavior patterns? How are they going to adhere to the medications and instructions given? And only basis that you can start generating credible data. You can start weaving mechanisms around patient generated health data. Can I give them a glucometer and expect that they'll monitor their sugars day in and day out? Or can they self administer medications in the best way? That is how you will be able to drive the future of care. While we weave all these mechanisms, what are our objectives? Our objectives are that the future customer of 2030 feels understood and valued, trusted that any data that I'm sharing is for my betterment, is for improving my outcomes. Third, that I have the option to opt for care in my preferred setting. I'm not being bound by a particular hospital, a particular set of guidelines which will be delivered only in an institution, that my insurance is commensurate with my needs. There are acute and chronic care plans and outside the hospital options that are preferred and provided, wherein I'll be incentivized for my healthcare. I need to be incentivized the customer as a customer to pursue prevention activities and wellness. I need to feel connected when somebody delivers personalized recommendations. Let's say somebody is 80 kgs, 40 years old, having probably a risk of diabetes. The recommendation needs to be personalized in terms of their genetic makeup also, not just in terms of a standardized diet plan that goes through. It needs to also cater to their taste, their preferences, vegan, vegetarian, non-vegetarian, vegetarian. All of this needs to be taken care of. And finally, I need to be empowered. I need to be given the choices on mobile phone. When you deliver that, you're delivering on 2030. Now, why we spoke the patient, payers, and providers, what exactly needs to be Vision 2030 when it comes to the larger picture? And the larger picture, when we talk about a vision on a large scale, what should it be? It should be based on six major principles: equity, integrity, respect, collaboration, responsiveness, and transformational leadership. People striving for care must be equitably treated. Avoidable things should be avoided for people at the bottom of the pyramid or the top. There needs to be an integrity and respect. Care needs to be delivered with the right integrity. Respect must be there for providers as well as patients at the same time. There needs to be greater collaboration between multiple systems. Our care must be responsive to what the patient needs, and every input from the patient should be treated with due respect too, so that we can make positive changes. And finally, there needs to be all of this needs to be done through transformational leadership, where leaders will acknowledge that change is due and they'll start thinking that, okay, I need to change. These are the 10 things I need to do, and maybe I'll achieve five, but I'll always keep striving to make sure that the next generation of care that I'm delivering is better. And if it requires me to change the way I think and change my ecosystem, I'm going to try for it. With this, I thank everyone for providing us this opportunity.
For more updates from CXO TV, please like and subscribe to our channel.